Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm chatting with Luis Resendez about his upcoming presentations here for the Birth and Beyond Navigating the Unexpected lecture pack. How are you, Luis?
I am great. Thank you.
It's wonderful to have you here. Your presentation is titled, What About Dad? Understanding and Addressing Postpartum Depression in Men. It is such an important topic. We don't talk about it enough. We barely talk about it. So that's why you're here. You're going to have this great presentation with us and in this lecture pack. And we're really excited about. But before we hop into your topic, tell us a little bit about your background and where you're located.
Yes, I'm a licensed marriage and family therapist. I have been practicing since 2009. I'm primarily located in Riverside, California. I say primarily located because I'm also licensed. I'm not only licensed actually as a mental health therapist here in the state of California, but I'm also licensed in Oregon and Texas, in the states of Oregon and Texas. And I am also an approved telehealth service provider for the state of Florida. And in these 15 years that I've been a psychotherapist, it's been a very rewarding experience, challenging at times, but nevertheless, just to see growth in my clients and, just profound positive change. It's one of those things that just constantly brings me back and just keeps me going from one day to the next. And, just maintaining just this positive attitude as best as I can. And that, just people are hurting, people are dealing with emotional distress, but that's why you're in their lives to make that difference. I specialize in working with men's mental health issues. It's one of those things that I'm very passionate about based on not only my own personal experiences, but I think of even just many men I've known throughout my personal and professional life that have struggled with mental health issues that probably would have benefited from seeking professional support that unfortunately they never did. So one of those things that also keeps me going. I am also an international speaker. I've spoken on several mental health related topics at national and international conferences. And I'm an adjunct professor at Pacific Oaks College in Pasadena, California, and which is actually coincidentally the college I had graduated with in 2010, where I received a master's in marriage and family therapy.
That is absolutely wonderful. Thank you for sharing that. Now, this topic of, understanding and addressing postpartum depression in men, that's very near and dear to your heart because of your own personal experiences, right? So describe briefly if you don't mind, how that, came to pass. And what I would also like to know is you are a family therapist. Did it take you by surprise that you were, affected by postpartum depression?
Yes, indeed. So my wife and I, we've been married since 2007. And, in the years after being married, we felt the pressure to have a family right away. So we tried to conceive, nothing happened. And then miraculously in 2011, we received news that we were going to be parents. So the pregnancy was a very smooth one. And in February 2012, our oldest son was born. In those days and weeks after his birth, I just noticed, feeling really tired, really lethargic, increasingly anxious. I was withdrawing from family and friends. I was even starting to question, my readiness in being a father. And am I up to task? Am I going to flood this or, mess this up or what have you? I just didn't feel myself. And even, just what she was telling me, even things that she was pointing out and noticing that something was off, something was wrong. So that coupled with me not wanting to see people, isolate myself from family and friends, it just felt like really something was off, something I've never felt before was wrong with me essentially. So what I had done was one day I was at work and just in front of my computer, I Googled postpartum depression. I saw the symptoms and I was in a state of shock. And I also added to my Google search postpartum depression in men. And I was mortified to, discover that based upon what I was reading, this was the issue I was dealing with. I was in a state of denial, even though consciously I knew that, yes, this all makes sense. This is why I've been feeling the way I had been feeling for the past couple of weeks. So it was scary, and just to accept that it took a little bit of time, but acceptance nevertheless is what led to the change that I sought to just help me find that state of balance, and essentially just become as best of a father as I could be
Mhm.
to my son, and as best of a husband as I can be to my wife. So that change that some years later was the catalyst for me writing this book and sharing my story, and hopefully just bringing about change and hope in the lives of so many families where a man who had recently become a father is dealing with some form of postpartum distress.
Absolutely. Now, in your research and your own experience and working with fathers and families, are there any key differences in how postpartum depression presents in men compared to women, would you say?
Yes. And so I would say the key difference tends to be related to more irritable mood. You know,
Hmm.
when you think of men, especially older men, the cranky grandfather, uncle, father, whomever, it is, or even just a man in general, is that, they're seen as, oh, they're just grumpy all the time or what have you. But the thing is that, men historically are conditioned to, just not open up with any emotional mental distress that they're dealing with, to just deal with it. But also too, when that's ever conveyed or expressed, it's usually in the form of irritability and even in some cases anger. So I think, at least based upon my observations, even in my own personal experience, one of those things, for lack of better words, I had noticed was just, increased irritability, and, that coupled with increased isolation, reluctance to engage with family members, friends. I was going weeks without not wanting to see anybody. I was really sluggish to return phone calls, text messages. I just didn't want to be around people whom I knew at the end of the day really cared about me, and in many ways they were concerned. But just my my energy and at any emotional, even physical level, just wasn't there.
Hmm.
So I think that's kind of one of the main things. And even just with a lot of family members, male clients I've worked with in the past, who have been concerned about that loved one in their lives, and that, well, how do we know something is wrong? Is that just, monitor his mood, be observant of his mood, but especially too, if you notice him increasingly more irritable, even for just reasons what you might identify as just not being able to explain, but still knowing that nevertheless, he just seems really more irritable.
Mm, absolutely. Yeah. Thank you for sharing that, because that is a good, thing to look out for, because it postpartum depression can have many different faces and forms and shapes, right? But the irritability that might maybe overlooked because that could manifest in something like being curt, or like getting into an argument that may not look like depression as such, but just in a different form. So what practical advice would you have for fathers who may be unsure of how to ask for help or recognize that they need it? Because as you mentioned, for men it is often very difficult the way they are brought up, and there might be cultural differences as well, as you mentioned as well, in your community. What practical advice could you share?
Okay, so um two two schools of thought on that. First one is that if there is that trusted family member or friend, it could be his partner, it can be, someone else. It can be
Mhm.
maybe his own parent, sibling, really close friend. If there's that person that he knows deep down inside he can confide in, then confiding in that person, sharing what's going on, in terms of just the changes, emotional distress, and things like that. If I had the opportunity to talk to a person who's on the receiving end of that information, my words of advice would be just listen. That's all you're
Mhm.
doing. You're just listening. I know as people in a general sense, we're inclined to want to help right away
Yeah.
and solve. And I the intentions are good, don't get me wrong, but sometimes that can backfire too. It can make the person just feel at the end of the day that they weren't heard. So just listen and validate. So, after listening and validating, if they felt inclined to just offer some words of advice or whatnot, and that seek out professional help, which leads me to number two is, speaking to a primary care physician, family doctor, whomever he goes to for just regular checkups and, general ailments and things like that, following up with the primary care health provider and sharing what's going on. And in turn, that primary healthcare provider can probably connect him with a mental health professional, a support group, maybe a psychiatrist if need be, but utilizing the resources at their dispense just to make sure that this new father is connected with the support that maybe as some time goes by, he's increasingly aware that he needs.
Yeah, thank you for sharing that. That was really good practical advice right there. And you mentioned also support group. That might be very beneficial because, seeing other dads, other men, saying like, yeah, I feel that way, or I need help, or, coming together as such might be very helpful too to, get that support so they don't feel like, oh, I'm the only one experiencing this, right? So that's fantastic advice there. So there, yeah, absolutely. What final wise words would you have? If you would like our audience to know just a little nugget of advice, what would that be?
Yeah, so in addition to just listening, I think in a general sense is that, what do we do to encourage our men to open up, but in ways that they are going to feel supported and listened to? So in not so many words, just being careful to refrain from saying anything that might be judgmental. I know when we share concerns with a loved one whom is struggling, we tend to interject a lot of our feelings in that. I feel worried, I feel concerned, and there's nothing wrong with that. I mean, that's a human response. I think at the end of the day, too, we got to be mindful that we're not making it about us. Not making it about us. I mean, yes, we do factor into it one way or another, but we also have to remember that it's his issue that he's dealing with, and just pointing out facts. So even if you see a new father whom is just increasingly irritable after the birth of a child, is isolating, doesn't want to be around family, friends, just isn't returning phone calls or texts, pointing those things out, just sticking with the facts, and that, I noticed you seem to be more irritable. You don't want to spend time with us anymore. You're not returning text messages. And sometimes you might even just have to leave it at that. And then at some point, revisit it and speak it again, because the idea is that the more you hear something, the more he hears something, it raises his awareness. And that, my family, friends, my partner, spouse keeps telling me these things, and maybe something is wrong. Because unfortunately, with mental health issues in men, many times, a good deal of the time, a good majority of the time, they're in denial that something is wrong.
Well, thank you. That was very helpful, Luis, for your advice there. And could you mention the name of your book again one more time for us? And do you have it here to show us?
Yes. So my book, What About Dad? Understanding and Addressing Postpartum Depression in Men, I published it last year, 2023. And I actually started writing it during the pandemic, believe it or not. It's just something happened. I put it to the side. I started writing it again, and lo and behold, it's out. So it is $12.99 on Amazon. There's also a Kindle version. And just I'm encouraging, the readers to just approach the topic with an open mind, because even just the title, with postpartum depression, I mean, well, what is this? What are you talking about? Approach it with an open mind. And really, just the intention of this book is to raise awareness. That's really why I wrote it. Raise awareness within family systems, within communities, within the healthcare profession. Just start these conversations, because these conversations are going to raise awareness, bring about change. Just hopefully, help men and families as a whole just find and regain that balance after the birth of a child. It's a wonderful thing. It's a beautiful thing to, have a child, to raise a child. We just have to make sure that the little kinks and nuances that come along with that we're working through those, all for the sake of maintaining balance, but also to make sure that the parent, the father, is able to have a healthy and loving relationship with his family.
Absolutely. Well, thank you, Luis, for this, and so much for being here with me today, talking about your work and, of course, the presentation here at Gold as well. Thank you so much.
Thank you very much.
And now some quick information for our viewers. If you're interested in this presentation and all the other presentations of the Birth and Beyond Navigating the Unexpected lecture pack, which is right now the add-on package to our midwifery conference when we get live in February 2nd. If you want to find out more about all of the wonderful presentations and the conference, we invite you to go to goldmidwifery.com for more information. Thank you, everyone, for watching, and have a lovely rest of your day wherever you are in the world. And I'll see you at the conference. Bye-bye, everyone.